So we watched the video that was the animation about how muscles fatigue, but let's go ahead and look at the feedback loops that are going to be involved here and some of the factors that will establish the fatigue that we see within muscles. So when we look at the aspect of fatigue in muscles, we have to look at a couple of factors within the muscle itself, primarily what type of muscle fiber we are recruiting and the amount of strength that we're going to get there. And there is an inverse relationship between the strength that we get from the muscle and its likeliness to fatigue. And there are two aspects that come into play here. One aspect is the amount of membrane that has to undergo the depolarization leading to action potential and contraction. And the other aspect has to deal with the energetics of getting ATP back to the muscle to allow for the continuation of the contraction. So if we look at strictly off of the ability to depolarize to get to the threshold potential, as we start doing contractions, we start getting a change in the intracellular compartments and extracellular compartments inside and outside the cell about the ions as it surrounds the membrane, as well as the ions available to the cell. This is going to lead to a change in the ability to get to threshold. Because I now have a harder time getting to threshold, I need additional stimulus in order to continue the contraction. Without that additional stimulus, I'm going to experience a fatigue. I'm going to experience a change in the contraction strength of the muscle itself. The other aspect that we have to deal with outside of the ion balance issue is the ability to get ATP back, and the combination of the change in ATP combined with intracellular changes taking place leading to inhibitory signals heading back to the motor cortex. So we start off with the excitation signal. The excitation signal leads to the contraction. We utilize our ATP-CP pathway in order to get the immediate return of ATP. This will give me a good 6 seconds worth of contractions all by itself. But most contractions are going to take place for beyond that 6 seconds, which means we're going to have repeated contractions, which means that we now have to deal with both our anaerobic pathways as well as our aerobic pathways. Our glycolysis, Krebs cycle, and electron transport chain, each one providing a slower return of ATP as we go through the pathway. At the same time, contraction between the fibrils within the filaments within the muscle itself start to induce tissue damage. That tissue damage, combined with a slower rate of return of ATP, is going to slow down the rate of contraction. We also start to see a change in metabolites within the cell itself. And so we start to lose the type 2X fibers from any type of maximal volitional contraction. If we're not trying to do maximal volitional contraction, we will be able to do a sustained contraction or repeated contractions for much longer periods of time. We keep contracting. As we keep contracting, we're going to continue to accumulate changes of metabolites, which is going to slow down even further the rate at which ATP is being returned. It's also going to induce additional tissue damage. This is going to combine to slow down ATP, reduce the rate of contraction taking place within the muscle, but it's also going to start to send nociceptive signals, pain signals, where we're going to start seeing changes in ROSs, changes in metabolites, ion imbalance, possible change in pH, and mechanical damage, all starting to send a signal that says we need to slow down the rate of contraction. We're going to start dropping some of the type 2 fibers. We get different afferent pathways heading back to the cerebral cortex. That's going to start to inhibit the spinal cord in terms of the motor neuron heading out to the muscle. We start getting a change in temperature within the muscle. So the muscle has started to hurt a little bit. The muscle has started to feel warm a little bit. All of this is due to the energetics as well as the friction and damage taking place within the muscle. We continue to inhibit heading back towards the cortex. And now we're saying, hey, dummy, you need to do something. You need to either stop doing the contraction or reduce the rate of contraction taking place. This is going to continue until we have full inhibition of the lower pathway and eventually full inhibition of the upper pathway. Now, this Inhibition on the upper pathway can be counterbalanced with what's referred to as central drive. That is the quote unquote want to continue doing the contraction or continue doing the muscle activity. However, the longer we continue to do this, the more tissue damage we're going to get, and the longer it's going to take to undergo repair and response for adaptation. We slowly start losing more and more and more, and so we can actually get to full inability to contract, or we're going to have such small amounts of contractions that we will volitionally stop the contraction itself. So what are some of the factors that are going to come into play here? Well, we have ATP issues, we have membrane ion balance issues. Those issues combined with other factors are going to come into play, leading to a loss of the ability to contract. So the reduced rate of ATP is going to reduce the ability to have any type of muscle contraction taking place, because we're going to lose the ability to have the power stroke taking place. Any ion imbalance that takes place, whether it is sodium, potassium, calcium, or magnesium, is going to reduce either the ability to get to threshold or have the interactions between the filaments taking place, in between the actin and the myosin. Inhibition at the neuromuscular junction, either by adenosine or by a change in acetylcholine, either released by the neuron or binding at the muscle itself at its receptor. Microstructural damage to the skeletal muscle is also going to lead to fatigue. This is also going to lead to issues with pain, which we'll talk about in a couple minutes here. A change in central drive, inflammatory signals, nociception, thermoception, all send inhibitory signals that say, hey, dummy, you need to stop doing this activity. Now, what I'd like you to do is think about what is not on the list that everybody talks about as relates to fatigue. And that's one question that we will approach when we get together and discuss this issue in lecture. Now, we are able to overcome this fatigue. We can do this by altering our central drive. And this is because I can overcome any inhibition signal by voluntarily over-recruiting the muscle. And like I said, this can lead to additional damage taking place within the muscle, but we can keep doing the contraction even after any degree of fatigue has set in.